I'm Dr. Darleen Claire Wodzenski with Orchard Human Services. And a question that I'm asked quite a bit from co-parents of narcissists is, what can I possibly say to my child to explain why their other parent is so cruel or so selfish or so self-centered or so dismissive of the child's needs or wants or opinions or preferences? This is a question that comes up a lot. And I think learning to talk about the narcissistic condition is very important. When we're working with children, we try to avoid really inflammatory language. I'll be honest, I'm not very likely to talk to a child about a parent being a narcissist unless the child brings it up. Because when the child comes in, the child is our patient or our client. Legally, the child is the identified patient of record. So it's not my job to diagnose or treat the parent, but it is within my scope of practice to notice some of the behaviors and traits and presentations of the parents, and then to provide support to the entire family unit and to support the child so that the child is able to cope and thrive. So one of the things that I do talk about is I give proper names to the things that the children ask to understand. And quite often, the child of a narcissist will say something like, they don't care. Why don't they care? How can somebody be so mean? How can somebody be so cruel? How could my own parent not care about me? How could my own parent hurt me this much? Or why is my parent so mean to my other parent? Why would anybody be that cruel to another person? And we try to help the child understand that all adults have their own set of values, their own ideas about what's right and what's not, and that we encourage the child to look within and find their own values, to decide for themselves, do they want to be someone who puts other people down in order to feel better? Or are they someone who wants to build others up and have compassion and integrity for self and others? We talk with children about the important words that they need to understand the phenomenon. Yes, we will talk about selfishness and we'll say, gosh, I noticed that one parent seems to do a lot of things that I think are very giving and kind and very unselfish. And then I notice the other parent seems to like to do things that pleases them, makes them feel good, makes them feel important. Have you noticed that? And we'll talk about that. And sometimes the children will come out and say, what is that? Why are they so different? What's it called? And we will sometimes help them with the verbiage to understand that maybe we're looking at a parent who is a little bit more self-centered. Sometimes a parent with a narcissistic personality disorder can be so cruel that we wind up having to explain to the children that there's something called sadistic. Sadistic is when a person harms someone or something else and has pleasure from it. We have to explain that you're not built that way. That's not part of who you are. And I'm so sorry that this is happening, but we're going to help you have the best relationship with this parent that you can possibly have, even though they sometimes seem to like to do things that seem pretty unpleasant and they seem to enjoy doing the unpleasant things. So being very careful, but always staying on the side of promoting the parents and the child to have the best, healthiest relationship possible. We always stay to that language. We say, we want you to have the best relationship with each parent that your parents will allow, because we intend to support you to be able to be available to have the best relationship with both parents. So any limits are going to happen from them, not from you. And we work very hard to help the children understand that it's their job to love their parents. We help them understand that we don't all love everything about each other. Maybe one parent does seem a little bit selfish, but the other parent may also have some personality flaws or quirks that the child doesn't love. Over time, we attempt to call things what they are. If the narcissistic parent does something that is extraordinarily harmful or emotionally disruptive, we will claim it and we will name it and say, that was really disruptive. That seemed hurtful. That would have been hurtful to me. We will claim it and name it. But beyond that, we try to get back to normalizing and saying, but I guess everybody makes mistakes. So how can you take care of yourself? How can you get the support you need? How can you connect with both parents and have a good day, feel good about yourself, and put your head on your pillow at night and go to sleep feeling happy and loved. So these are the ways that we approach working with children who are growing up in families where there's at least one parent who suffers from something akin to narcissism or a narcissistic personality disorder. This is Dr. Darleen Claire Wodzenski with Orchard Human Services, uplifting lives by counseling, educating, and caring. Please check out our trainings. We are doing some incredible trainings on narcissism, attachment disorder, and how to create a safe therapeutic space for children of parents who suffer from some sort of personality disorder like narcissism. Find our website at orchardhumanservices.org. See you on the orchard side.